You hear a gastroenterologist talking to a patient called Joseph Alverez. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Alvarez. Your GP has sent us the letter about your problems, but why don't you tell me in your own words what's been happening?
Yes. Well, I've had blood in my urine and like this sharp kind of chest pain. I had an ECG for that, but it didn't show anything serious, but the pain was still there. So my doctor sent me for an ultrasound of my abdomen, but the result was all right. I think that's why he sent me to see you.
Yes, and you had a normal endoscopy 2 years ago. Well, how are you now?
My stomach always feels full up. It's just the same as before. It's been happening for at least 18 months now. If I'm lucky, on a good day I'll have no pain at all, but on a bad day it's pretty constant.
Does it ever wake you up at night?
I never sleep very well. I usually wake up because of poor breathing.
The pain you get during the day, is it when you're hungry or after eating?
Before I eat. After I eat, the pain usually goes away at first, but then it comes back again after about 30 minutes. It depends what I'm eating though. If it's something like oranges or lemons, they seem to be too acidic.
Ever had any problems swallowing food or liquid?
No, nothing like that. But it can feel like it's burning on the way down if I drink something hot.
I see. Anything else you can think of?
I often burp a lot after eating or drinking. That actually helps me feel better. I've never really vomited, even when I've been feeling my worst. But I can get this terrible taste in my mouth when I'm burping. It's like something very bitter, sour almost.
Have you ever coughed up any blood or noticed any blood in your stools?
No, thank goodness.
Okay. Are you on any medication?
I used to take tablets for my ulcer. They were red and yellow. Losic, that's them. I'd take one for every 20 days. They seem to work quite well as I remember. That's it though. I don't really like taking a lot of pills.
It sounds like apart from this trouble, you're quite well then.
Yes, touch wood. My wife and I eat a pretty healthy diet, I think. I never go out to pubs, but I have a glass of wine with dinner a few nights a week. I used to smoke 10 or 15 cigarettes a day, but I quit 2 months ago.
What about your family's medical history?
Well, I have 7 brothers and 2 sisters. They're all well and living in Spain. My mother died at 90 of a heart attack and my father at 77 of a stroke. Like I said, I've never really had any problems myself apart from this pain. I suppose I'm worried in case it's cancer.
Well, all of your tests have been fine, and your GP did a heart rate test, and that was all right too. I'd like to examine you and send you for some blood tests.
Extract 2. Questions 13 to 24. You hear a pulmonologist talking to a patient called Pam Herbert. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Now, Pam, I see you've been referred to me by your GP, and I've got your notes here, but Perhaps we could start by you telling me, in your own words, about the symptoms you've been having, any treatment you've had, how that's gone, and anything else you feel I should know.
Well, to be honest, I've just been feeling absolutely terrible. I've got this awful cough that just won't go away no matter what I do. And I keep coughing up all this stuff. It's sort of brown. It looks horrible. And the cough's much worse at night, so of course that's been interfering with my sleep. So I'm what you would probably call fatigued all the time. I feel like I have to try to get through every day rather than live it. It doesn't help that, weirdly, I'm just not hungry at the moment either. I'm really off my food, and that's led to me losing weight, which is probably a good thing. But it's not helping with my energy levels.
Are you otherwise well? I mean, have you noticed any other changes in your health?
Well, one quite big thing is that I'm finding it difficult to walk very far. I can manage short distances, but if it's going to take longer than 10 minutes, you can forget it.
Okay.
And then just a few little aches and pains, but they can be annoying. I've noticed that my rib cage feels really painful when I've been laughing. It's agony. And recently I've been getting this sort of feeling down my right arm. It's like a tingling feeling, I suppose. I can't use my arm at all when it's like that.
And how long would you say that all this has been going on?
Oh, quite a few months. It all started when I had flu back in January. So about 9 months ago, I suppose. That quickly turned into glandular fever, and I was ill for a good 6 weeks with that. I don't even feel like I've fully recovered now. And then I've had 1 or 2 quite nasty chest infections lately, and they've been difficult to shift.
Well, that's certainly something we can look into. I see you're a smoker. How long have you smoked, Pam?
Well, in total, I was working this out with my husband the other day, it's about 35 years. I know that sounds bad, but it hasn't been constant. I have quit quite a few times, and it's just that I always go back to it. I've always suffered from insomnia, on and off anyway, and giving up always makes that so bad. It means I can't function properly because I'm so sleep deprived. One of the reasons I'd like to give up cigarettes forever, though, is to get my sense of smell back. You know, that went about 10 years ago. It's amazing how much you miss it. I mean, I didn't realise how much pleasure it gave me. It affects so many different aspects of your life.
And as far as current medication is concerned?
Well, for about 10 years now, I've been taking a statin, I don't remember what it's called.
Don't worry.
And I'm still using my salbutamol inhaler. I take that everywhere I go. I find I get out of breath so easily, and I do tend to panic. And I'm still on the antidepressants I was prescribed a year ago. They seem to be working really well, so I don't want to change anything there. It's all good, apart from the obvious worry and inconvenience with this cough and everything.
And any allergies?
Well, I never drink milk. It makes me throw up. And years ago, my GP diagnosed an intolerance, which came as quite a relief. And I don't know if it counts as an allergy, but hay fever always makes me really miserable. I literally can't go outside. I just stay indoors with the windows shut and take my medicine.
This is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now, look at the question 25.
Hello, doctor. What are the different types of blood tests for leukemia?
Well, blood tests, such as complete blood count, can detect leukemia. A complete blood count determines the number of red blood cells, white blood cells, and platelets. Cytogenetics Analysis is a blood test in which a sample of blood is examined to check for changes in the chromosomes of the lymphocytes. Peripheral blood smear determines the presence of blast cells and shows the type and quantity of white blood cells. Other various blood tests may be ordered to see how organs are functioning and if they're being affected by leukemia. Question 26.
Doctor, could chemotherapy inside the bladder reduce recurrence of cancer?
According to a recent study, patients who had the chemotherapy drug gemcitabine placed inside their bladder following the resection of the tumor had fewer recurrences. Out of more than 400 subjects, 384 completed the trials and were included in the study, which randomized them to receive the chemotherapy drug called gemcitabine. To treat the bladder cancer, they implanted it into the bladder and let it settle there for an hour, and the other group with saline without gemcitabine in it. They kept the patients under observance for every 3 months for 2 years, thereafter every 6 months for another couple of years. What they observed was the recurrence were 34% less. The purpose of this study was to prevent bladder cancer from invading the muscle wall of the organ. Moreover, this is a very simple method without any significant side effects.
Question 27.
Doctor, could keeping our immune system under control be as easy as managing our diet?
Well, for instance, the immune cells involved in multiple sclerosis mainly depend on sugar to activate the disease. However, the common drug for multiple sclerosis, dimethyl fumarate, blocks this energy pathway. Contrarily, these energy pathways are feasible targets to treat certain diseases that might extend to dietary measures. I'd like to be extremely cautious about this because nowadays diseases and diets have become very common. However, the theory that energy metabolism is crucial in the way the immune system reacts suggests that there are possibilities that different kinds of diets are going to have impact on our immune system that we're just starting to understand but are yet to understand it completely. I wonder at some stage if the autoimmune diseases like multiple sclerosis may include diet as part of the disease management strategy, as well as other diseases where immune system and energy metabolism are essential, such as cancer.
Question 28.
Bacillium coli is an intestinal protozoan parasite that can infect human beings, which are transmitted through the fecal-oral route by contaminated water and food. Although Bacillium coli infection is mostly asymptomatic, patients with other severe illnesses can experience abdominal pain, persistent diarrhea, and sometimes a perforated colon. Bacillium coli is a parasitic species of ciliate alveolates that causes the disease Bacillidiasis, which is the only member of the ciliate phylum known to be pathogenic to humans.
Question 29.
Hello, doctor. What is schistosomiasis, and what are its causes?
Schistosomiasis, also termed as bilharzia, is caused by parasitic worms.
Although these worms are not found in the U.S., more than 200 million people are affected worldwide by this disease. In terms of impact, this disease stands next to malaria as the most devastating parasitic disease. Schistosomiasis is also considered one of the neglected tropical diseases.
The parasites causing schistosomiasis
dwell in certain types of freshwater snails. The infectious form of the parasite, known as Cercariae, emerge from the snail, therefore contaminating water. Most human infections are caused by Schistosoma mansoni, S. japonicum, or S. hematobium. One can become infected when the skin is exposed to contaminated fresh water. Question 30.
Hello, Doctor. What is hypoxia, and what are its causes?
Well, hypoxia means low oxygen, but is described as a deficiency in the amount of oxygen that reaches the body tissues. Hypoxia differs from hypoxemia, which means insufficient amount of oxygen in the blood. In hypoxic hypoxia or hypoxemia, the tissues do not get adequate amount of oxygen since there is a lack of oxygen in the blood flowing to the tissues. Generally, hypoxic hypoxia is caused due to inadequate breathing and other causes. In anemic hypoxia, low levels of hemoglobin lead to a decreased ability of the blood to carry oxygen that we breathe in. Therefore, the tissues get a diminished supply of oxygen. The stagnant hypoxia, or circulatory hypoxia, is caused due to inadequate blood flow, resulting in less oxygen supply to the tissues. In histotoxic hypoxia, the tissues are incapable of utilizing the adequate amount of oxygen available, despite the adequate oxygen inhaled through the lungs and delivered to the tissues. Metabolic hypoxia occurs when there is excessive demand for oxygen by the tissues than usual. Oxygen may be absorbed, transported, and used properly by the tissues. However, due to a condition that raises metabolism, it is still insufficient. Sepsis is a perfect example of this.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36.
Hello everybody. I am going to explain to you different types of hemolytic anemia. Hemolysis is the breakdown of red blood cells that typically has a lifespan of 120 days. After this duration, they die and break down. One of the main functions of red blood cells is to carry oxygen to every part of our body. Therefore, in case the red blood cells break down abnormally, there will be very few of them to carry oxygen to our body parts. Certain diseases and conditions cause red blood cells to break down too early, resulting in fatigue and other more severe symptoms. There are different types of hemolytic anemia, and the conditions can be either inherited or acquired. Let me explain to you certain disorders and conditions of different types of hemolytic anemias. Inherited hemolytic anemias usually occur due to a faulty gene that controls red blood cell production. While moving through the bloodstream, abnormal red blood cells may be fragile and break down. Sickle cell anemia is a severe inherited disease where the body produces abnormal hemoglobin, causing the red blood cells to have a crescent or sickle shape. Sickle cells usually die within 10 to 20 days, as the bone marrow can't produce new red blood cells fast enough to replace the dying red blood cells. In the US, sickle cell anemia mainly affects African Americans. Thalassemias are the inherited blood disorders where the body can't produce certain types of hemoglobin in adequate quantity, causing the body to produce less healthy red blood cells. Hereditary spherocytosis occurs when the outer covering of red blood cells, called the surface membrane, is defected. In this condition, red blood cells have an abnormally short lifespan and a ball-like or sphere shape. Hereditary elliptocytosis or oval cytosis causes a defective cell membrane in which red blood cells are abnormally oval in shape, are not as flexible as normal red blood cells, and have a shorter lifespan than healthy cells. Glucose-6-phosphate dehydrogenase deficiency occurs when the red blood cells are missing an important enzyme called G6PD. The lack of enzyme causes the red blood cells to rupture and die when they contact certain substances in the bloodstream. For the patients with G6PD deficit, severe stress, infections, certain drugs or foods can cause the destruction of red blood cells. Certain examples of such triggers include aspirin, anti-malaria drugs, sulfur drugs, non-steroidal anti-inflammatory drugs, naphthalene or fava beans. Pyruvate kinase deficiency is caused when the body is missing an enzyme called pyruvate kinase. And with this condition, the red blood cells tend to break down quickly. Acquired hemolytic anemias occur when the hemolytic anemia is acquired. In this condition, although the red blood cells may be normal, certain disease or other factors will cause the body to destroy the red blood cells in the spleen or bloodstream. With immune hemolytic anemia, the immune system destroys healthy red blood cells. The three main classifications of immune hemolytic anemia are autoimmune hemolytic anemia, which is the most common hemolytic anemia condition. For some unknown reason, this disease causes the body's own immune system to produce antibodies that start attacking our own healthy red blood cells. This disease may become severe and grow very aggressively. Alloimmune hemolytic anemia occurs when the immune system attacks transplanted tissues, a blood transfusion, or the fetus in some pregnant women. This disease can occur if the transfused blood is a different blood type than our own blood, and it can also occur during pregnancy when a woman has rhesus-negative blood and her fetus has rhesus-positive blood. Drug-induced hemolytic anemia occurs when a medicine triggers the immune system to attack its own red blood cells. In such case, one may be drug-induced hemolytic anemia. Chemicals in medicine, such as penicillin, can attach to the red blood cell surfaces and cause the development of antibodies. Mechanical hemolytic anemias cause physical damage to red blood cell membranes, which can cause destruction at a faster rate than normal. The damage may be caused by changes in the small blood vessels or due to the certain medical devices, high blood pressure during pregnancy called preeclampsia, or a condition that causes seizures in pregnant women called eclampsia. Malignant hypertension or a rare blood disorder such as thrombotic thrombocytopenic purpura that causes blood clots to form in small blood vessels throughout the body. Moreover, participating in strenuous activities can also result in blood cell damage in the limbs at times. With paroxysmal nocturnal hemoglobinuria, the body will destroy abnormal red blood cells caused by a lack of certain proteins more rapidly than normal. Individuals with this disease are at increased risk for blood clots in the veins and low levels of white blood cells and platelets. Certain infections, substances, and chemicals can also damage red blood cells, resulting in hemolytic anemia. For instance, toxic chemicals, malaria, tick-borne diseases, or snake venom.
Extract 2, questions 37 to 42. You hear an interview with hematologist Christine Ford about blood donation. You now have 90 seconds to read questions 37 to 42.
Hello, my name is Dr. Christine Ford. I'm a hematologist on a mission to make giving blood more accessible to the masses. Blood donations and transfusions go hand in hand in most cases. Sufferers of certain conditions like thalassemia, sickle cell disease, and hemophilia, for example, require regular transfusions. In fact, the number of people in the world needing a blood transfusion is increasing. In most countries, blood donations are voluntarily made, and the number of charitable blood donors has increased to 112.5 million people over the years. According to the World Health Organization, most of the blood donated by voluntary donors is given to recipients who are 65 years and above. However, in low-income countries, 65% of the blood donated is transfused in children under the age of 5. The donation rates still vary in both the low-income and high-income countries, in that high-income countries account for 32.1 donations, upper-middle-income countries account for 14.9, while lower-middle-income countries account for 7.8. It's likely that this is the reason why, even though theoretically donating blood should be purely voluntary, some states do offer financial incentives to encourage people to donate. Blood is often extracted from an individual who volunteers after screening for certain diseases like HIV/AIDS, Ebola, and hepatitis virus, among others, has been completed. It can either be transfused as a whole, or some parts of it like the plasma, platelets, or white blood cells only. According to the National Health Survey, whilst the majority of people are allowed to donate blood in the U.S., the practice is regulated. One such regulator is the Advisory Committee of Safety of Blood, Tissues, and Organs, who released new rules regarding the treatment of donors in 2017. According to a national health survey in the United Kingdom, the number of daily blood donors needed to provide enough blood for the number of transfusions that occur daily is 6,000 donors per day. Annually, the number of new donors needed by blood donation centers is approximately 200,000 people. To date, the majority of blood donations are made by people over the age of 45, spurring multiple campaigns aimed at encouraging young people to participate. Blood donation does not depend on ethnic characteristics, although significant efforts are made to encourage ethnic minorities to increase their engagement with blood centers due to the significantly lower number of registered donors from diverse populations. So first, let's consider the characteristics of the ideal donor. The person must be fit, healthy, and free of viruses like HIV/AIDS or any type of cancer. Ideally, they would weigh between 7 and 25 stone and would be between 17 and 66 years of age. As an exception, previous donors can be aged up to and over 70 years old if they have given blood within the last 2 years. Assuming the aforementioned criteria is met, there is a preference for male donors over female donors, as their additional average body weight means that they are likely to have suitable iron levels. Furthermore, their platelet count is usually higher, and as such, they are on average able to give blood more frequently, every 12 weeks opposed to every 16 weeks for women. After a suitable donor is found, in order for a blood transfusion to take place, the blood must be screened, and it must be ensured that it is safe to use. The grouping and cross-matching of the donors and recipients' blood are also important prior steps. During the transfusion process, the recipient must be keenly monitored for any reactions to the blood being transfused. In addition, their vital signs like blood pressure, temperature, and pulse rate, among others, should be observed quarter-hourly and documented correctly throughout the whole transfusion process. Part of my mission to demystify the process of becoming a blood donor is speaking to people who have either given blood in the past or have given it serious consideration. Using an anonymous survey, I ask them why they decided to partake in this altruistic and life-saving act. I find that by anonymizing the results, we are able to elicit more candid responses, meaning that the reasons I hear are rather surprising. The majority of people cited reasons such as that the good it does far outweighs the slight discomfort during the procedure, or words to that effect. However, every now and then I'd come across a story about a person who felt that they would have died if it wasn't for their donor and the stranger who made blood available to them. The new lease of life they now have has made them so grateful that they wish to pay the kindness forward to someone else. Regardless of the reasons they gave, it was rather surprising to find that not a single participant cited monetary reward.